Very good afternoon and welcome to our session on the topic Obesity and Fertility. We are glad to have Dr. Major Uma Maheshwari, Senior Consultant in Apollo Fertility Annanagar, among us today to help us understand the topic. The doctor will take us through that and highlight all the important details of that. If you have any questions, post that in the comment section. The doctor will answer it later. Also, be there till the end to just capture all the small and minor details. Doctor, you have the stage now.
Hi, good afternoon. We are going to talk about the association between obesity and fertility. This is a very, very important topic because worldwide obesity has hit an epidemic proportions. Be it any country, be it any proportion of the reproductive age population, male and female, we do see a good number of obese individuals. And once we understand how obesity impacts fertility in males and females, it is easy to spread awareness as to how to avoid it, what to do to manage it, and how it might affect the fertility and what is the way forward. So that is why we have chosen this topic, obesity and fertility. Even in our country, obesity has become very, very common in all socio-economical strata, and we see fertility problems in obese individuals quite often across the age spectrum and in both sexes. And obesity impacts fertility in many different ways. So, looking at the female aspect, obesity is plays a very important part in metabolic disturbances. Fertility comes later. Let's talk about the metabolism first, because in this age and era, the easy availability of junk food, high energy food means carbohydrate rich, fat rich, low fiber, and moderate protein food, fast food, low physical activity, stress, poor sleep habits, more screen time. These are the things that contribute to obesity even from the childhood. So, a child which is obese today is going to become an obese adolescent and obese adult tomorrow. So, the fertility issues, especially in females, it is a very good approach to start tackling it at adolescence itself. So it is very, very important that we sensitize the parents towards the possibilities, how to go about it, how to prevent it, etc. etc. So usually in the pre-puberty, peri-puberty age, when girls are in school, we must, as parents, we must encourage them to take part in physical activities, in sports activities, to keep them active. These days there is a lot of impetus, lot of pressure on academic um, performance. Yes, that is one aspect, that is true, that is important. I'm not saying that is not important, but equally important is physical fitness. Why is physical fitness at this age particularly is important? Because this age is the foundation for the girl's future health. That is why physical activity, a good optimum physical activity, a mindful diet which is rich in nutrients, which has calories appropriate to the activity of the child, physical activity levels of the child, which also supports the academic energy requirements, is very important. That is why, if we can prevent a child becoming obese in early childhood and in adolescence, half the problems is already tackled. Okay, so coming to the puberty part, when a girl is obese, that means the fat levels in the body are on the higher side. The proportion of the fat is on the higher side. Now, normally it is a practice to look at obesity only from the lens of body mass index. Body mass index is a proportion of the height to the weight. So, this proportion, body mass index, might not be always the right approach to look at obesity, because when we are talking about obesity, we are talking about visceral fat. The best method to see if we are looking at a higher visceral fat proportion, the best way is to check the waist hip ratio. Any waist hip ratio which is more than zero point 0.8 is on the higher side. So that is why the insurance companies, to assess a person's health, look at waist hip ratio rather than BMI only, because this is going to tell us about the health uh, trajectory of the individual for the whole life. So that is why waist hip ratio, as I said, zero point 0.8, more than that, is a high risk point for obesity. So any individual who is obese, which means the visceral fat is on the higher level, there are going to be hormonal implications. The first point is such individuals usually have some amount of insulin resistance. Insulin resistance means, what is insulin? Why is insulin so important? Insulin is important for the metabolization of the glucose that is circulating in our body. Why is glucose such an important molecule? Because glucose is the energy currency of our body. So anything that we eat, the food is digested in the intestines, and when it is assimilated by our body, the energy currency is glucose when we are talking of carbohydrates. So this glucose has to be processed properly by our body, so that the energy can be dissipated for various activities. These activities can be bodily functions, it could be voluntary activities, voluntary actions, etc., etc. So insulin resistance leads to hyperinsulinemia, which means if the circulating insulin is not able to effectively metabolize the glucose. Now, glucose metabolism means the use of glucose for energy, as well as the storage of excess glucose as glycogen in the liver, as well as fat in our fat tissues, adipose tissues. So, the use of glucose by our body, by each cell of our body, is dependent on insulin. So if there is insulin resistance, automatically the pancreas, which secretes the insulin, starts secreting insulin at a higher level. So this leads to hyperinsulinemia, more of insulin, more of circulating insulin in the body. Whenever the amount of insulin, circulating insulin in our body, is on the higher side, it has many more implications. It has implications on the growth, the fat, and other hormones. So all these things together lead to excess of male hormones in a female body. Normally, all of us, whether male, whether female, we have estrogen, we have testosterone. What is important is the ratio between the estrogen and testosterone in female, testosterone and estrogen in males. So when we are talking about female, because of excess of adipose tissue, the androgens, the male hormones, start rising. Now, when male hormones start rising, these male hormones have an impact on the ovarian function, leading to anovulation. Now, when we are talking of anovulation, we all know that during the pubertal years, the girls, even when they start having periods, for the first few years, the periods are likely to be irregular, because not in all cycles the girls will ovulate. So, in such a cycle where the ovulation has not happened, where the circulating estrogens are on the higher side, where the circulating androgens are on the higher side, these girls are likely to have heavier periods whenever they bleed. Okay, so this is the starting point of a lifelong cascade of anemia in adolescence. So, obesity leading to insulin resistance, leading to hyperinsulinemia, leading to hyperandrogenism, leading to anovulation, leading to irregular periods, and whenever the periods happen, heavy bleeding and the start of anemia. So, apart from this, when the girl grows up, when she is reproductively active, when she gets married, when she is keen to start a family, this annual and ovulation, along with obesity, plays a havoc with her fertility. So, because there is no ovulation, there is no egg. Apart from that, when the androgens, the circulating androgens are on the higher side, when the estrogen is on the higher side, the endometrium, the formation of the endometrium, the proper proliferation and ripening is not able to happen because there is lack of progesterone. So again, there are heavy periods, irregular periods, prolonged periods. So all these things, take the morale of the girl down. So this is number one. Talking about the next aspect, as I said, obesity and anovulation eventually leads to a metabolic condition. So, as we all know, as we speak, the polycystic ovarian syndrome, PCOS, PCOD, it's not only a fertility problem, it's a metabolic problem, wherein apart from the anovulation, the girl is likely to be obese, the girl is likely to have insulin resistance, the girl is likely to have hyperinsulinemia, she is likely to have hypertension, she could be borderline diabetic, or she could be a frank diabetic as well. All these things together, along with hyperandrogenemia, leads to reproductive problems in terms of equality, in terms of poor endometrial growth parameters, leading to negative impact on fertility. Okay, so the entire spectrum, all these things together plays a havoc. Along with these signs and symptoms, one very important aspect is dyslipidemia. Dyslipidemia means an abnormal lipid level. Abnormal lipid level, the normal lipids in our body, LDL, HDL, VLDL, and triglycerides. Out of these four, the HDL is good cholesterol, which is very, very important for reproductive function in both males and females. So, while we are talking of HDL, the other three, the LDL, the VLDL, and triglycerides, they need to be kept at a certain level, normal level, for an optimum reproductive function. Okay. Now, cholesterol is a very, very important molecule when we talk of reproductive system because all reproductive hormones need cholesterol as the starting molecule, as the starting substrate. So that is why any abnormality in cholesterol levels eventually boils down to an abnormal hormone levels. So that is why the cholesterol levels play a very, very big role. As I was speaking, the HDL is a good cholesterol. Now, usually what we see is in people, in individuals wherein the LDL triglyceride is on the higher level, automatically the HDL is on the lower level. That means the cholesterol, which is not so good, is higher. The cholesterol, which is good, the lipid, which is good, is on the lower level. So HDL is very important because HDL, we find HDL at a good concentration in the follicular fluid. That means in individuals whose HDL levels, the circulating levels are lower, are likely to have a negative impact on the egg quality. Apart from this, the triglyceride, this plays a very important role in the pathogenesis of atherosclerosis. So we talk of atherosclerosis of the cardiac vessels, the brain vessels, but the same pathology, the atherosclerosis, also starts, having deposition in the blood vessels of the ovary and on the uterus. So eventually, the ovarian blood supply is affected negatively, the uterine blood supply is negatively affected. So all these things, along with hormonal imbalance and ovulation, these things start a milieu wherein hormones at the right time, they're not there in proper concentration, ovulation might not be happening, the male hormones, the androgens, are on the higher side, the bleeding is heavier, the girl is likely to be anemic, the girl is likely to be vitamin D deficient, dyslipidemia is there, she is obese, there is poor physical activity uh, profile, she is likely to have thyroid hormone imbalance because naturally in obese individuals the requirement for thyroid hormone is on the higher side. So in obese individuals, even though their thyroid may be functioning properly, but there could be a supply demand imbalance because of the obesity, because of the increased need. So that is why subclinical and the clinical hypothyroidism is not uh, very uncommon. So, on the background of all these things, if the girl is pre diabetic, if she is hypertensive, then the entire, forget the fertility part, the general health itself starts getting affected negatively. So, we in reproductive medicine, we all speak of fertility as a privilege, but survival as a priority. So, we talk of fertility only when the general health is optimal. So, here in this case, the general health itself, when it is negatively affected, the fertility is automatically affected negatively. So, the starting point of all these things is obesity. Why obesity started? Poor sleep habits, inadequate sleep, poor quality sleep, disturbed working patterns, that means a lot of night shifts. Why is this so important? Because in our brain, we have a small gland which is called pineal gland. This is the body clock of our body. This senses the sunlight and darkness. So when this gets disturbed, there is a small, uh, there is a very important hormone, melatonin, that comes from our brain that is disturbed, leading to impaired body clock, leading to impaired secretion of hormones. Now, secretion of reproductive hormones, though they happen from the ovary, there is a boss which is called the pituitary, which is in the brain. So this pituitary gland secretes FSH and LH in tandem with the higher organ, that is hypothalamus. Hypothalamus is something which again secretes an endocrine product called gonadotropin releasing hormone. So these two organs, these two endocrine organs, these two secretions, the hormones, are directly under the effect of the pineal gland, the melatonin, the body clock. So once the sleep is disturbed, all these things in cascade start getting affected negatively. So altered sleep habits, high energy food, poor physical activity, stress, they all serve as the starting point of the problem. So now looking at the fertility aspect again, dyslipidemia, diabetes, higher circulating insulin levels, higher circulating androgens, they all set stage for poor egg quality. Now, poor egg quality, the fertilization might be happening, but progression to an embryo stage might not be happening. The embryo, we call them as blastomeres. These are the cells that are there in the early stage embryos. In individuals who have higher cholesterol levels, higher lipid levels, higher triglyceride levels, we see that embryos are sometimes are of poor quality. So starting from the egg quality, the embryo quality, an endometrium which is out of sync with the embryos, with the ovarian cycle, leading to implantation problems, leading to miscarriages, are very common in obese individuals, individuals who have dyslipidemia, diabetes. So, something which is starting from a lifestyle which affects the metabolism ultimately starts affecting the fertility. So, in obese individuals, the treatment also is likely to be slightly difficult because such ovaries are sometimes resistant to the hormone stimulus. So, such people might require a higher hormone dose for ovulation induction. Such people require uh, various other molecules to control the other hormones that are higher or lower. So these things together complicate the treatment aspects. And in spite of a good, robust ovulation induction protocol, such people might not ovulate. So, in such people, the treatments are likely to fail also in a good proportion of people. So, the threshold of taking such people towards advanced fertility treatments is usually lower in the community these days, because the success of IUI programs, the success of timed intercourse cycles is lower in these people. Apart from these things, people who are obese are likely to have lower libido, they are likely to have poorer sex life, they are likely to have irregular intercourse, all complicating the already complicated fertility issues. So, that is why a spontaneous natural conception in obese individuals has started deteriorating, has the incidence has started going down, making such individuals need fertility programs. So, even if we talk of advanced fertility treatments for such women, as I said, the egg quality is negatively affected, the embryo quality is negatively affected, the endometrium is out of sync, implantation failures are on the higher side, miscarriages are on the higher side. Even if implantation happens successfully, even if the woman is diagnosed to have a good clinical pregnancy, a good heartbeat, she is likely to have obstetric complications during the course of her pregnancy because of the obesity. Such individuals, such women are on the higher risk for developing gestational hypertension during pregnancy, gestational diabetes during pregnancy. Such women are more likely to have premature delivery, bleeding problems during delivery, etc. etc. So ultimately, something that started during childhood has impacted the fertility of the woman, the fertility, the obstetric career of the woman, and not only that, the health of her offspring. So, in nutshell, obesity, the lifestyle issues, the diabetes, the hormonal imbalance has affected her metabolism, her cardiovascular health, because atherosclerosis has a direct impact on the cardiovascular health. She ends up being hypertensive, she is likely to have thyroid imbalance, etc. etc. So, in nutshell, lifestyle is the starting point of something which is easily preventable, which is easily avoidable. So that is why physical activity is very, very important. And the dietary intake of calories should commensurate with the level of physical activity. So a person who is leading a sedentary lifestyle should ideally avoid high calorie rich food. A person who is physically very active, who takes part in physically rigorous activities, even if that person consumes high calorie food, is likely to metabolize, because there it is, the body is likely to require calories, is likely to require the building blocks, the carbohydrates, the proteins. So that is why in female, this is how it impacts the fertility. Now, looking at the males, obesity affects the male fertility in three ways. Number one, obesity, as I said, more of visceral fat means more of estrogen in the body. So that is why the testosterone to estrogen, the proportion gets disturbed in obese men. When this happens, the testosterone values on a comparative basis, when we compare it with estrogen, starts going down. So the ratio goes down favoring the estrogen. When this happens, the male is likely to have erectile dysfunction. Erectile dysfunction means failure to achieve or maintain erection so as to have a fruitful sexual intercourse. So, starting from libido, the erectile dysfunction, and the performance of the sexual act starts getting affected. The next comes the hormones. As I said, because of the higher estrogen which is coming from the fat, the proportion of testosterone is going down. Now, the testicular structures, they all need testosterone in a certain proportion. So, when this testosterone, the circulating testosterone levels start going down, the spermatogenesis, the sperm formation itself can be affected negatively, leading to count, motility, morphology abnormalities. Along with this, if the man has dyslipidemia, if the man has diabetes, again, these things together with the hormonal problems are likely to have a higher negative fat metabolism. Now, this abnormal fat metabolism leads to reactive oxygen species. So, reactive oxygen species ends up damaging the DNA in the sperm head. So, in addition to the sperm motility, count, morphology abnormalities, the sperm DNA fragmentation is also affected negatively. So, all these things together affects the quality of the gametes, the number of the gametes. Obese men, whether they are diabetic or not, whether they are dyslipidemic or not, are likely to be hypertensive. Hypertension itself, along with the medicines, the antihypertensive medicines, are a very big factor for erectile dysfunction. So, obesity affects not only the gametes, not only the number and the quality of gametes, it affects the libido negatively, it affects the sexual performance negatively, it affects the quality of the gametes, and of course, the hormones. So, that is why in these times we are encountering more and more couples wherein one or both the partners are obese. So because of their obesity, the simpler treatments, the simpler fertility treatments are likely to fail, leading to a advanced fertility treatment. So even advanced fertility treatments, the success is negatively affected by obesity of the female partner as well as the male partner. And over and above, the course of pregnancy is also complicated. That is why obesity is something that we need to tackle as a community, as a social movement. We all know that obesity is currently in our society in epidemic proportions. We, as medical professionals, it is our duty to spread awareness about the impact of obesity not only on the general health but fertility as well. I repeat, survival is a priority, reproduction is just a privilege. So forget reproduction. But for general well being, for general health, it is very, very crucial that we avoid eating high energy food. We should all adopt healthier lifestyle choices. We should all be physically active. We should encourage our children to be physically active. The current generation of mobiles and laptop dependent children should be driven out into open grounds to start playing as we played during our childhood. Thank you very much.